Welcome back. Now, safe and clean water is a luxury for many in southern Africa. Humanitarian aid agency World Vision says, though, there's been a significant increase in the number of children as well as families accessing safe water. Millions are still in need. Now, this as countries such as, or rather in southern Africa, experience the impact of climate change, conflict and the COVID-19 pandemic. So to talk more on this, on World Water Day, I'm joined by Dr Emmanuel Opong. He's the World Vision Director for Water, Sanitation and Hygiene in Southern Africa. Dr. Opong, thank you so much for your time and welcome to the South African Morning. I mean, this is quite a concern. It seems year in and year out we talk about access to water, and it seems millions of vulnerable children as well as those poor families still are unable to access water. Why is this so?
Yeah, I think we must admit that we want to thank governments and other partners who are working in the Southern Africa region to provide water. I think they've done well, but again, the challenges we are having in our region cuts across issues of the flooding and drought, which then affect the quality of the water as well as availability. Because of the climate variability within the various countries, flooding and drought, these have significant impact on the availability of the water, and that makes it very difficult for people to access water which is safe.
You know, Dr. Opong, we can't have this conversation without the context of COVID-19 as well as exploring the aftershocks and impact of this pandemic. How would you say COVID-19 has impacted access to safe water in the region?
It has had significant impact on access to water because most areas who do not have access to water, the messaging around washing hands requires that you need water to wash your hands. And if water is not available, then you cannot wash your hands and practice the things that can prevent you from getting COVID. And therefore, World Vision, we have made an effort, even during the COVID period, which we want to thank governments, because most government make us one of the essential services. And therefore, we're able to deploy our staff to the field to be able to provide the water for the communities to be able to practice washing hands and prevent them from getting COVID.
Right. When we look at this year's World Water Day theme, valuing water, I mean, how do you think, this theme would sort of assist in coming up with resolutions as well as sustainable solutions with regards to access to water?
I think water, as we all know, plays a very critical role in every aspect of our life. We intersect with water right when we get up in the morning, right up to the time we go to bed. And so the value of water cuts across just for health. It helps in livelihood, it helps in education, it helps in healthcare facilities. And you know that there are many healthcare facilities in developing countries that do not have access to 24-hour access to water supply. And we all intersect with healthcare facilities one way or the other. And therefore, if we don't have water in areas where we intersect with life, then obviously it has impact on us. And therefore, that's why we're calling for everyone to engage in ensuring that wherever we intersect with, wherever people are, especially the most vulnerable people, have access to water.
Right. And without a doubt, I mean, Dr. Opong, water infrastructure comes at a cost. How do you then advise government as well as their development partners to navigate the cost issue? Because when we talk about cost in an African context, in a southern African context, one would also mention the corruption, the looting behind some of the funds that are meant to be deviated and redirected, rather, to access to safe water as well as water infrastructure. So what would your advice then be to governments as well as the development partners?
I think we need to establish ways by which people can be accountable, right from where funds are released right to the community. And one of the ways we have been working, helping to address that issues, is setting up helping the communities to set up advocacy groups and therefore be able to hold themselves as well as the government accountable. And that should cut across just not at the community level, at the district level, at the government level, set up accountability mechanisms, holding people accountable to the funds that have been released so that together we can provide access to the community. And you are right, there's a lot of corruption, especially in the water sector, and therefore each of us, especially setting up systems that will hold each person right from the government level to even the community level, will help us to address these issues and be able to provide access to the most vulnerable people who need it so that we can improve their health and their well-being.